Good afternoon, everyone, and welcome to today's session. Mia Umar, Navina, Subhendra Banerjee, and many more. Piyush Bandari, Yash Ramanuj, Dr. Khan, and many more who are across the country. So, we will have quizzing as a means to appetize, to stimulate our preparation so that we are online, we are awake, we are fighting, we are spirited. That are the most important essential traits to become the NEET PG topper. To be enthusiastic, to be energetic, to be perseverant, studying every day, to be fully charged. They are the essential traits to become a winner. So I want all of you to turn out to be the winners, read every day, and appetize you to study every day. Are you ready with the smartphone in your hand, with the YouTube on the laptop before you? You have the questions on the screen, and you have answers to be placed on the Kahoot ABCD. Okay, so please go to kahoot.it, kahoot.it on your mobile phone browser. Very good. So once you do that, yes, kahoot.it, you need to go to. So once you do that, I'm now going to start the game. This is the pin number. You are able to see the pin number. You need to enter the pin. Piyush, Dhanalakshmi, Muhurtam, Pravalika, Karthik, you are into the game. Sharad, Ravikumar, Jyoti, Mahi, oh, very good to see 001. Navina, very good. Sarah, please call some more of your friends to join the Kahoot quiz contest. Today we are going to have a wrestling competition in dermatology. Let me see how good you are doing in dermatology. Millie, very good. Dhana, if you make, I'm going to ask you 11 questions. If you make 11 out of 11 correct, you will get rupees 40,000 worth of onlinembbs.com video library, full-scale grant test, 30,000 MCQs Q scanner, and almost 1 lakh PowerPoint slides of notes. Everything which is worth of rupees 40,000, instant activation as a prize. But you need to score 11 by 11. Are you ready for the game? Yes. Let's make a start. Even if you are a little late, don't worry. Just go to kahoot.it and enter this pin number. Now opens up the first question. 3, 2, 1. A 56-year-old woman had an abnormal pap test at the age of 35 that required cervical conization. She's currently sexually active and has no pain with intercourse. Her last menstrual period was 3 weeks ago, and the pelvic examination is being shown. So what is your observational hunch about the diagnosis? Only one is right. Committing on vitiligo. Excellent. So let us see who is that one who made it. Banerjee. Very good. Now, the next question. A 20-month-old girl presented with rash and blisters that started this morning. Yesterday she has fever, responded to ibuprofen. This morning parents noted erythema, peeling of the skin around the mouth. The face is edematous, perioral crusting is there. A single pustule is noted. Oh, only one is right, committing it as staphylococcal scalded skin syndrome. Now let us see, it is the Sarah who is able to smell the diagnosis from distance. So, doctor, you should know a few points about staphylococcal scalded skin syndrome, which is a blistering skin disease. Staphylococcus aureus, which produce exfoliative toxin, which is responsible, that will disrupt the keratinocytes from adhering one to the other. There will be a prodrome of fever, initially some skin tenderness, then generalized erythema will be there, flaccid blisters, which are mainly on the flexural areas, which is the classical feature, and Nikolsky sign is typically positive. In the case of the staphylococcal scalded skin syndrome is what you need to remember. Very good, Sarah. Now, the next question. A 76-year-old man presents with a small swelling. He has worked outdoors his entire life. There is a small nodular lesion with a central ulceration. It is firm, non-tender, pearly, indurated. Now the question comes, what is the most likely diagnosis? Come on, punch, 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 punch. Very good. 8 of you are emphatically sure about the answer. Basal cell carcinoma. Basal cell carcinoma. So, Karthik ascends up the ladder, so also Sharath, and Sarah is still on the top. Now, the next question. A 24-year-old woman comes to the emergency department with a rash and pruritus. Rash and pruritus. Have a good look at the rash. The itchy rash developed about 10 minutes after she took a old amoxicillin tablet. Her lungs are clear on auscultation. The blood pressure is 120 by 80. She has no wheezes. What do you want to do? What do you want to do? Very good. Giving epinephrine would be too aggressive, and sending to Epstein-Barr virus antibodies is an overshoot. And the right answer would be treat her with antihistamine is what you need to remember. So that brings Karthik to the top, being earliest to crack the answer. Very good. Now the next question. 69-year-old woman comes with rough, dry, scaly skin. She has these symptoms. You can see the rough, dry, scaly skin. Have a good look at it. And she felt these symptoms intermittently. And there is no erythema or exudates. She is applying topical emollients. A 69-year-old woman. Very good. 10 of you cracked. See, those questions which are easy are easy for everyone. And those questions which are tricky, only the most well-prepared can be able to crack it with an uncanny sense of common sense, which is uncommonly available. So that's most important. No worries. It's all a question of getting 953 topics, high-yield topics straight. You have to have that focus. In every topic, you should have 20 points in your fingertips. And once you are ready, like a bulldozer, with these 953 topics and almost 30,000 very key points you need to know. So that is the reason we are creating a lot of 2-minute animation videos in which around 20 points are being quickly showered for you. And you have all those whiteboard animations available on the YouTube /online MBBS. So please subscribe to this channel. So now, doctor, you should remember ichthyosis vulgaris. It is a chronic, inherited. Dad had, granddad had, same condition. So inherited skin, diffuse dermal scaling, and filaggrin is the gene which is associated. And typically, the skin appears like a fishnet, and it will worsen in winter. So these are some of the essentials that you need to remember. Now comes the next question. A 66-year-old woman presents for the evaluation of a pigmented lesion on her right forearm. She first noticed the lesion 6 months ago. And she says it is itching. There is a dark brown lesion on the dorsal surface of her right forearm. It has a smooth border, eccentric nodule. What is the next step in the management? Wow, that's good. Only 4 are able to crack it. Pinning down on excisional biopsy is the next most important investigation. A pathologist is like a Supreme Court judge. We physicians, MD General Medicine, are liars. Much bigger liars are the radiologists who talk about shadows. Who speaks the truth? Surgeons who cut and see the truth. And the pathologists who see the truth in the microscope. They are the true speakers. They know the truth of the diagnosis. We physicians and radiologists, we will only talk stories, right? So be very sure what you are good at. So very good. Ravi Kumar is sitting on the top. Now the important point you need to know is, if you suspect melanoma, the patient should undergo excisional biopsy with initial margins of 1 to 3 millimeters of normal tissue is what you need to remember. Yash Ramanand is saying, sir, cushions are very long for less seconds of time. Okay, we will try to see that long cushions will get, now it is 30 seconds. We will try to make it say 40 seconds for you to answer. Okay, or maybe 1 minute. Let's see as we go forward. But every day you are going to have 5 to 6 quizzes. Please be part of our Telegram group. Ramanaj will be very happy. Ugly duckling sign. Where do you see? Ugly duckling sign. So, Yash Ramanaj will be happy man with this question. Yeah, we will also include this kind of questions as a relief. Very good. 6 of you. Rightly said. Ugly duckling sign is seen in the case of malignant melanoma. So that brings Muhurtam and Veronica ascending up the ladder. Okay. Now, you should know one important point about ugly duckling sign. What is the meaning of it? If there are multiple pigmented lesions, a lesion with an appearance which is different from others, like dark brown rather than light brown, nodule rather than a flat lesion, that represents a melanoma, which is called ugly duckling sign of melanoma. You have to be very sure about. Now comes the next adrenaline push. A 4-week-old boy presented with 5 centimeter skin lesion with the overlying hair on the back. His 6-year-old brother has neurofibromatosis. The remaining skin is all normal. Only in this area he has it. Now the question comes. What is your spotted diagnosis? Very good to see 28 online students. Wow, that's good. 10 of you rightly cracked it. Congenital melanocytic nevus. Congenital melanocytic nevus is the classical lesion. It is not nevus flavius. It is not nevus simplex. This is one of the favorite questions in the tomorrow's exam. So let us see what is. Yeah. So now let's go to the next question. So you should know a few things. This patient is having congenital melanocytic nevus. So what is that? It is not malignant. It is a benign proliferation of melanocytes in the first few months of life, like what you have seen in this baby. There will be solitary hyperpigmented lesion, and typically the risk of transformation to melanoma definitely there, and it increases up to 5%. So that's the only point that you need to remember. And nevus simplex, nevus flavius. What do you want to know about them? They're flat, blanchable, erythematous, vascular birthmarks. That's the point. It is the eyelids, glabella, nape of the neck. They are the classical things, locations for the nevus simplex and flavius to appear. So I leave the literature for you, and many times we discussed in dermatology. Now, 56-year-old woman presents with skin lesions on her right arm. She has noticed it 3 weeks ago. In the past, she has undergone mastectomy. And after that, she developed this swelling of the right arm. There's a non-pitting edema of that right upper extremity. There are 3 firm purple papules on the inner surface of the right arm. Very good. So what are you suspecting in this given case? Lymphangiosarcoma post-mastectomy. So you need to do the biopsy of the lesion. Very good, very good. So that brings Ravi Kumar onto the top, and Karthik is trailing behind apne Nikatdam Pratidvandvi, Ravi Kumar, and Muhurtam also is trailing up. So you should remember, post mastectomy, there is a chance of a lymphangiosarcoma secondary to previous breast cancer therapy. And in order to make your diagnosis, you need to do once more the Supreme Court judgment, biopsy. So tomorrow in the NEET PG exam, whenever there is a question on what is the next best investigation in case of the skin tumors in dermatology, what is going to be your emphatic answer? Skin biopsy. That would be the safest answer. A 3-month-old boy presented with progressive facial rash that started 4 weeks ago near his eyebrows. You can see the rash. The rash does not appear to be painful or pruritic. There are erythematous scaly papules even on the nasolabial folds. 3-month-old baby, a very important clue. Punch your answers, doctor. Very good. 9 of you are right. Proud of you. It's called cradle cap. Cradle cap is what you need to remember. Very good. Ravi Kumar is on fire, followed by Karthik, Muhurtam, Veronica, and Sharath. So, doc, you should be very sure on seborrheic dermatitis. It is considered to be associated with the colonization of Melissesia furfur. And cradle cap is something that you need to remember. Now, the last question for the today's dermatology quiz. 34-year-old woman comes to the physician for the evaluation of the skin lesions. Her blood pressure is 140/86. There are similar hyperpigmented velvety lesions are there in the axilla and groin. Now, looking at those lesions in this 34-year-old woman, very good. That is acanthosis nigricans is what you are able to see, which is often associated. There are two kinds, malignant and benign form. A benign form of acanthosis nigricans is often associated with glucose intolerance, insulin resistance, PCOD, etc., is what you are able to see. So that brings Ravi Kumar raging with the top score. So obesity, diabetes, PCOD, they are the classical associations of a benign acanthosis nigricans. So doctor, that is the afternoon cup of tea with all of you. Very good. That makes Ravi Kumar on the top and Karthik followed by Muhurtam. And thanks to all of you for participating in this quiz. So at least every day we have 5 to 6 quizzes, and after the quiz is over, I'm going to look at the results, the reports. So I'm going to publish the PDF of the report into the Telegram group. Be part of our Telegram group. So if I go to the reports of today quiz on my console, I can see the today's report. What were the difficult questions and who did not finish? Ishwar Yogi and Muhurat could not finish. And I will go to the reports and I can be able to see that there are 21 players, 20 questions in 20 minutes, and I'm going to download the report and see what are the descending order of the ranking. So once you play 4 to 5 quizzes, now you can see I got the quiz report. I'll try to give you the quiz report, how it looks like. Yes, you can see the quiz report. In the quiz report, we have the final winners. Final winners. So Ravi Kumar answered 9 questions correctly, 2 wrong out of 11. Karthik could make 7 questions correctly. Muhurtam could make 7. Veronica made 7. Sharat made 6 questions correctly. This report I am going to give you as a PDF after the end of the quiz in our Telegram group, and also tell all your friends to be part of onlinemmbbs.com video library. And every day evening we have a couple of hours of a free live broadcasted session on the YouTube, and we'll have 4 to 5 quizzes every day to play, so that you are fully ignited, excited, enthusiastic in your preparation. Great afternoon, and keep reading, keep studying, don't give up, and let us win the game of NEET PG. Good night.